Next slide. Remember, any child under the age of 18 involved in a commercial sex act is a victim under federal law and falls under mandatory reporting guidelines. There are no child prostitutes. There are only victims. Go ahead. You know what, let me go back to that. Oh no, yeah, you're right. No, that's good. 40.3 million people are victimized worldwide through modern day slavery. And you can see 29 million were women and girls, and 5 million were victims of forced sexual exploitation. Next slide. Why are you vulnerable to trafficking? You're vulnerable to trafficking due to a couple of reasons. Socioeconomic classes, everybody's equal. Traffickers do not discriminate. They prey on you if you are vulnerable by poverty, vulnerable by adverse childhood experiences, disabilities, and LGBTQ communities, the indigenous populations, are very vulnerable to trafficking. There's 4 stages of human trafficking that exist: recruiting, grooming, trafficking, and immersion. And immersion is where the victim accepts the trafficked life as normal, forms trauma bonds, they do not self-identify or self-disclose as a victim, and they become willing participants in the trafficking lifestyle, and they often commit crimes while under the influence of the trafficker. Those that are looking for just a way out of an impossible situation, survival, they just want their basic survival needs met. They're fleeing abusive homes. So we know human trafficking is happening here. I'm not going to spend a lot of time on 101 human trafficking, as I call it. That information's in your packets, and everybody else is doing that. I'm more interested in what are we going to do. I want to take action. The 3P paradigm, next slide please, looks at prosecution, protection, and prevention, and is the framework used around the world to combat human trafficking. Today we are going to focus on prevention. And when we focus on prevention, we focus on the root causes that are affecting the supply and the demand and the distribution chains for human trafficking. The average age a victim is trafficked for sex is age 13. We are seeing them as young as ages 4 and 6. We're seeing little boys and little girls. This is an example, next slide, of a toolkit. The Shared Hope International Protected Innocence Challenge puts this out, and it provides resources to guide efforts to combat human trafficking from a legislative side. It looks at different laws and recommendations for legislative gaps. Next slide. This is an example of a downloadable toolkit page, again put out by the Protected Innocence Challenge and Shared Hope International. They do this for every state. As you can see, Vermont raised their grade from a D to a C. I challenge all of you to raise that grade to an A. Where human beings are concerned, there's nothing less that's acceptable. Nurses have a powerful legislative voice, and it's time we advocate for these victims using the might of our profession. Next slide. This is another downloadable toolkit page for Vermont, and it goes on, and I just want you to see what it looks like, and it tells you exactly where you can focus your efforts on what to do to protect these victims and from the prosecution piece. Next slide. Next slide. Traffickers prey on the most vulnerable through social media platforms and also exploit them in these virtual street corners. Next slide. In January of 2018, Dr. Boucher and Thorne published the results of a survey that detailed how technology plays a role in domestic minor sex trafficking. Survivor Insights further highlighted the exploitation of victims through these social media platforms. Thorne also found that survivors reported entering prostitution, which means forced sexual assaults if they're if they're a child, as young as infancy through age 17, and 1 in 6 were forced into the life before age 12. Thorne also said that 55% of domestic minor sex trafficking survivors who entered the life in 2015 or later met their trafficker online for the first time through a mobile app, website, or text message. And 63% of traffickers used online platforms to groom and potentially exploit vulnerable victims. Next slide. In 2018, the Pew Research Center found that 95% of teens have access to a smartphone and 45% are online all the time. They also found the average age a child gets their first cell phone is age 10, and a full 50% of children have social media accounts, Facebook and Instagram. We have survivors that have reported being recruited and being exploited off of these platforms. Next slide. I've included this information in your packets. As part of our prevention strategies as nurses, we educate on seatbelt safety, helmet safety, and car seat safety, but we are not educating on how to protect our children from traffickers. And they are loving the fact that we are not, because they have copious amount of youth that they can just exploit through these platforms. So we must be aware of these risks and what they are doing, and they are going after anyone. Also note that sextortion is a thing, and it's a term that the FBI and others use for coercing an unwilling partner into sexual acts, especially online. The average age for that is 14. Victims are as young as age 8. And Fortnite and Minecraft can be used to lure these minors for sex, according to the FBI. Next slide. So when we look at our strategic planning and how are we doing in healthcare and kind of the boots on the ground, next slide, we're not doing very well. According to Long and Dowdle, a 2017 study found that 88% of trafficking survivors that came in contact with a healthcare professional during their trafficking situation were not identified, and we missed them. And imagine if we missed that many child or elder abuse cases, because if they're under 18, involved in the Commercial Sex Act, they are victims. Next slide. Why did they come in? They came in for physical violence, psychological symptoms, substance abuse disorders, pregnancy-related complications, attempted suicides. Next slide. And remember, the trafficker, they're nothing more than a product. So if you deliver pizzas and you need your car, or you work for Amazon, you need your van, you're going to get your van serviced or your car. Well, they have to get their product serviced because they need to continue to put out these children and this money. And the average amount of money and income that a trafficker can get off of one child is about $400,000 a year of tax-free money. And that's based on 200 sexual assaults a week, 10,000 sexual assaults in a year. Because remember, you can say John, but they can't consent, so they're being raped. So that's kind of the way we need to look at it. Next slide. The SOAR to Health and Wellness Act of 2017 was created, became public law in 2018. It is an excellent resource. It is online, it is free, and you can get to it by the Office on Trafficking in Persons, and you can just type in SOAR, Stop, Observe, Ask, Respond. They offer CEUs for it. Please go online, please take the training. It is specific for healthcare providers, and it is, again, excellent. I can email any of you guys this information. Some of it I'll have in your packets. Next slide. This is what Vermont wants you to do. If you have a suspected case, they want you to call the Vermont Human Trafficking Hotline. And if they're a child under 18, they want you to call the Department for Children and Families by calling the Vermont Centralized Intake. Nationally, when we speak, we tell people to call the National Human Trafficking Hotline, and that's what I also recommend. And Vermont also has 211. I believe, 211.
Yes.
And you can call that, and you can ask them to help you and tell them you have a suspected case of human trafficking, and there's specialists that can assist you with questions. Remember, it's not a violation of HIPAA to call the National Human Trafficking Hotline or to call 211 if you don't give out any protected health information. So if you just say, I have a 23-year-old female, I suspect this, they don't want to make a report, as long as you don't say, well, it's such and such, and their name, and release their information, it's not a violation of HIPAA. And we need to know our mandatory reporting guidelines and our laws, which we'll look at in a minute. Next slide. So what do we do? How do we get there? Well, in your packets, I've put what I think that we need to do. And you can look at that later. But first of all, you need to know Human Trafficking 101, and everyone's doing a good job of letting you know the difference between trafficking and smuggling and that stuff. And you've heard red flags and assessments. And we need to look at resources and the root causes of human trafficking. Next slide. First, we need to think safety when we go to interact with these individuals. Safety for you, safety for them. Assume anyone with them is a trafficker and they are a threat. Doesn't matter if they're a school-age friend, with them. Traffickers can be children. Traffickers can be cheerleaders in the schools. Traffickers can be anyone. They can be their family member. Family members traffic their children for sex. They traffic their children for sex to be supplied with drugs or to be supplied with a place to sleep. That's called familiar trafficking. There's also terrorist organizations that traffic, and they use that as a means of income, and also to entice others to come in to join their terrorist organization. You have sophisticated criminal enterprises, you have gang-related trafficking, and pimp-controlled trafficking. You need to have a clear separation policy in place at your institution, because you need to know if you have this, much like we pull people out that we're suspicious of with domestic violence, and we make that fake trip to x-ray. These things need to come about and be in place. And I've got protocol examples in your packets as well, and kind of things to help guide you. Next slide. Next slide. Conducting a head-to-toe assessment in this population is paramount in identifying victims that do not self-disclose. Next slide. Kind of getting the hang of this now. You want to conduct it in private. You don't want to allow anyone to come in with them because you assume that they're a participant in it. You also need to know that they're electronic devices. Often at times they'll have more than one cell phone, but they also can be listening in, and they have voice recording apps and things to where they can hear and record the entire conversation. So even if no one's with them, they can still be listening, and that puts you at risk. Whenever I come in contact and I start to do my exams on these individuals, I make sure every electronic device is turned off, and I just tell them it minimizes interruptions and helps to keep you from repeating your story over and over again. You want to have a designated staff member to care for these individuals, and that will be in your policies. So what I want to see is I want to see nurses who go out and are motivated to find your institution, to see what your protocol is, how you're screening. Are you screening in Epic or FirstNet? And is it working? Do you have a protocol? Because you don't want to screen unless you have a protocol or a policy in place. You want to get your hospital attorneys involved to know your mandatory reporting guidelines as far as if it's an adult and they don't want to report, because if a firearm is involved, you may be obligated to report. If it's a child, you have to report under mandatory reporting guidelines. So you want to just be kind of cognizant of that, because tribal law and state law is different from federal law. Federal law is clear. Some state laws are stricter than federal law. So you just need to know your state and what is your responsibility. But if they're a minor under age 18, they're a victim. Next slide. Go ahead and go to the next slide. I'm just trying to, next slide, move a little faster. Okay, when we get into the physical assessment, I've also put some of this in your packet, so I'm moving quick, but you've got information in there. We have to look at psychological manifestations of trauma, because they have, a lot of times trafficking survivors have complex PTSD at the extent of war veterans. And they're coming in with somatic complaints of, abdomen pain, back pain with no organic cause. They're also coming in with signs of hyperventilation syndromes, panic attacks, jittery. They can be quite fearful, and they can be so afraid that it's out of context to the injury. And you may have someone that comes in with a PID or a foreign body that's retained in their rectum, or they may come in with an ankle injury, and they are so hysterical. What you don't know is the reason they're hysterical is because they're being abused and sexually assaulted 200 times a week, and maybe they were thrown out of a car by a trafficker. So what you see and what we excuse away sometimes out of convenience may not necessarily be what's actually happening. Next slide. So anyone that comes in with substance use disorders, you need to screen for trafficking. Just kind of look for red flags. And it's not that hard. We're going to learn about that. So folks that are suicidal or overdoses that are coming in. You have someone come up, pull up, drop off an overdose. The guy comes in, yep, does it all the time, overdoses. They're unconscious, you can't ask them. You admit them to the ICU, they recover, you discharge them to your involuntary hold facilities, and no one ever screens them for human trafficking. And that gentleman was in fact their trafficker. They couldn't cope anymore, and they were discharged back into the hands of the trafficker because the institution called them for a ride. So, and we're missing it. And I'm only telling you because I missed it. I mean, I've missed these cases, and it haunts me. Next slide. Next slide. Let's look at the head and scalp really quickly. If they have head trauma or concussions, just pay close attention to that. They'll have tattoos or brands in their hairline or their neck. They'll have bald spots or missing hair sometimes because it's been pulled out. Next slide. Ear, nose, and throat is a biggie because they can come in with strangulation injuries. These sadomasochistic acts or deviant sex acts, a buyer can pay more for those, and they can be strangled as part of this, or made to participate in choking games, or as a coercive tactic by a trafficker. So they're not going to come in and tell you they were strangled, but you may see petechiae, little pinpoint red hemorrhages around the throat, on the face, the eyes. They can have ringing in their ears, buzzing, tunnel-like hearing, and other forms of hearing loss. They can have petechiae around their ears, and they can have injuries around their ear canals. You also want to see if they have any missing teeth. Our delayed presentations are toothaches and our dental facial cellulitis that are coming in. And any delayed injury, worry about a delayed injury. Start to question. And traffickers are pulling out the teeth of these individuals as a form of torture. So they are coming in for those complaints. They may have perforated eardrums. Next slide. As far as respiratory cardiovascular, when we look at our labor trafficking, they can come in because they don't have personal protective equipment, or they're being forced to work in meth labs or factories, and they can have exposure to mold or asbestos, or chemical exposures to meth, such as chest pain, sore throat, cough, nausea, dizziness, and lack of coordination. So they're coming in for these. They also can be like your nannies who, or your household workers who maybe came in on a special visa, and maybe they got a PPD skin test and it was positive. For whatever reason, the health department put them on drugs for possible TB. They never followed up. They never gave them and finished the prescription. And maybe they came in for a delayed presentation of a fulminating tuberculosis later. Again, any delayed presentation, or if you have a person that says to you, well, I need to call my employer to ask permission to be treated for tuberculosis, it's kind of a red flag. So remember, they keep them geographically vulnerable to where they don't know where they are and they don't know their address. So that's a red flag if they don't know their address and where they live. They also keep them vulnerable through a language barrier. Next slide. They can have functional GI symptom complaints, which don't have an organic cause but are like stress or anxiety related. And if you have one GI symptom, you're more likely to have an anxiety or a disorder or depression. They also can have foreign bodies in their rectum. We could be seeing that from where they were forced into these deviant sex acts, and they come in and they say they've had rough sex, but in reality, that's their trafficker with them, and they have this rehearsed story. Next slide. OBGYN is a biggie. Any sexually transmitted infection in a minor is a red flag. When I say red flags, look at it like this. If you have a heart attack, right? You got jaw pain, you got left arm pain. Well, if you just have jaw pain, you could have a toothache. But if you have jaw pain, left arm pain, you have an EKG that has ST elevation, you have a heart attack, right? Dissecting aneurysm, they look a certain way. look at red flags as signs or symptoms. So if they have an individual that's in possession of all their documents, if you have an individual that insists on doing all the talking for them, who doesn't want to leave the treatment room, that's all up in your face, or that is removing them from treatment being rendered very quickly, then all of those are suspected signs. We've also had women who have reported that the trafficker allowed them to get care, but they said if you don't get home in a timely manner, then they threaten their children. So they're still under the psychological control of that trafficker. You know, this is not like the movie Taken a lot of times. They don't have physical chains, but they have the chains on their mind. So we need to be aware of those psychological, those trauma bonds. They can have debris in their vagina, and it can be from, they force packing when they're on their menses. So to force them to service these johns a day. So after 30 sexual assaults or 20 sexual assaults, and they finally go to remove those tampons that they put in there or the packing, it may not all come out. So you can be seeing these lost tampon patients coming in. You can be seeing them for lots of PID. And what do we do with PID? You're waiting, I got a chest pain. You know, that's what we do, right? A lot of these women have reported going in for PID because they've got to keep that area functioning. So that's why they're coming in to get treatment. And that's the only reason they're allowing them to. So we need to be cognizant and look for other red flags. So, okay, so I have a woman I'm doing a pelvic exam on, and the doctor is pulling out debris, little pieces of cloth or whatever, or she's got a lost tampon, and there's a gentleman that refuses to leave with her. He does all the talking. He filled out her registration paperwork. She doesn't have her ID, her passport. A lot of these are American kids that we're seeing. So a lot of them are U.S. born. So that's why we call it domestic minor sex trafficking. So they're coming in for these. So if you have these other things going on, you have to think about the separation policy to pull them aside to screen them further. Do they have, we've seen victims with profuse vaginal bleeding to where they've had to go to the operating room, and some have had to get hysterectomies because they've been so traumatized. So be alert for any pregnant minor and kind of wonder, you know, what's going on, that they're a pregnant minor. Also looked at your delayed presentations for ruptured ectopics, for ruptured appendixes. Why didn't they get care? Delayed care for wounds. You know, why didn't they get care that they needed for wounds? Next slide. When we look at human trafficking, we have to realize that traffickers are using opioids to coerce these individuals to do what they want. They're getting them and recruiting them, and they're forcing heroin onto them, and they're forcing them to be addicts. They weren't addicts when they went into the life. They were forced. Or they're using that as a debt bondage situation to entice them to be into the life. Regardless, we need to be screening in our labor and deliveries, our NICUs, our mother babies, any maternal opioid use disorders and neonatal abstinence syndromes. Every 15 minutes, a baby is born suffering from opioid withdrawal. And this is fundamentally increasing the supply of human trafficking, because these are the ones that get introduced into the child welfare system, juvenile justice system, and 50 to 90% of those children are being trafficked for sex out of the juvenile justice system. Next slide. And just a last point on that other side, you don't have to go back. We have survivors, a lot, that report being 7, 8, 9 months pregnant and being forced to still have 30 sexual encounters a day. So they're coming into your labor and delivery units for preterm labor, for abdomen pain, vaginal bleeding, complications in pregnancy, because they're being trafficked. So we need to stop kind of looking at folks and saying, well, you know, what is wrong with you? And we need to start looking at what happened to you and kind of look through a trauma lens, because we live in a trauma society. Next slide. I'll address that one in a minute. When we do look at the back pain, all I want to say about that, because we've got to keep going, is they can have musculoskeletal back pain and complaints from poor ergonomics. There's no ergonomics when you're being labor trafficked. And so they have poor work designs. They can come in with amputations of their extremities. And they also can have tattoos that are sexually explicit in their sacrum area and in around their mons pubis. They can have bruising and scarring back here from where they're beating them back here also. And when we look at neurologically and those complaints, they can have stress-induced asthma, anything stress-induced asthma, stress-induced anxiety, panic attacks again. But you look at your headaches that you think they're coming in a lot for migraines, and you kind of are like, are they stressed? Are they anxious? They're coming in for these anxiety, these psychological complaints. And in a person with trauma, especially trauma that starts early, coping mechanisms is substance abuse or smoking or food addictions, because that's how you cope with the underlying trauma, and you can't speak the unspeakable, is you cope by eating and by these other things. They're comfort measures. Next slide. Nutritional abnormalities, they're coming in for vitamin D deficiencies from lack of exposure to sunlight. They may have fine or brittle hair. Are we screening our severe electrolyte abnormalities that are coming in? Our dehydration. We see it all the time with the roofers and landscapers, migrant workers that are coming in, and they are so profoundly dehydrated, we're giving them 2 or 3 bags of fluids and discharging them. Did we screen them for labor trafficking? Did we kind of even ask these questions? Next slide. Are we screening them any delayed suture removal, delayed wound at all for healing? Especially there's a bacteria, and I'm not going to say this right, Vibrio vulnificus, and it can be introduced in the crabbing industry into cuts in your hand. And if they don't wear gloves and they don't have this personal protective equipment, and they can get this bacteria, and it can be 50% fatal. So you'll see them for a delayed wound, and you'll see them for septicemia as a result of this. And I'll show you on the next slide in just a second an article about that. We also need to be looking at any type of, are they dressed inappropriately for the weather? If you see someone out here and you're not bundled up like Meredith, in her robes, and they maybe have on this really short skirt and heels, and you would think no one would dress that way, and they look sexually provocative. Are they coming in for hypothermia, or other issues and complications from that, from being forced to walk the streets or service johns in locations to where they don't have those things taken care of. Another one is, are we screening, how many times do we admit people for self-inflicted injection sites, intravenous drug use, and they come in, they're infected. What do? Give them Vanco and we admit them upstairs, right? Are we screening them for human trafficking with what we know about how traffickers are using opioids to control these individuals? Do they have bruises in various stages of healing? That's another one. Next slide. When we look, this is the article picked apart. You can find this on the Polaris website and the National Human Trafficking Resource Center. It talks about the Maryland crab industry, but it looks at labor trafficking and sex trafficking. And it looks and talks about the systemic infection and how it's 50% fatal. And it's from this bacterium that is coming in from the seawater and these open wounds. So just want you to be aware of that. Next slide. Let's look at the next slide. When we talk about these tattoos, are they sexually explicit? And that means that it's a form of advertisement meant to evoke a sexual or deviant reaction, and are contrary to common sense as to why someone would put that on their body. They're usually, again, on the mons pubis or here, and they say things like, go raw, eat me, something about pound, something that denotes sexual connotation. Or, next slide, they can, this again is sexually explicit, they can have the $sign. So if you see this tattoo or tattoo around their neck or in the back of their hairline or on their arm or down on their thigh, next slide. Other tattoos. This one we see quite a bit, the crown. Next slide. Do they have road rash from being maybe thrown from a vehicle? Maybe you need to investigate that a little further. You know, how did they get this deformed ankle injury that they delayed and they didn't come in for treatment for? Was it because they were drunk, or is that what the guy told you that was with them and he's really their trafficker? We need to be careful we're not diagnostically overshadowing, and I'll talk about that. Next slide. When we look at some of these, do they have signs of cigarette burns? And those are a little 1 centimeter diameter. They come in clusters and they can fade in a few hours. And often a burn will take the shape of the object that inflicted it. So they're coming in with burns. Traffickers will burn their individuals with cigarette burns as a form of torture and coercion. Do they have certain petechiae in their throat or palate from frequent oral sex? Petechiae around the conjunctiva from being strangled. Next slide, graphic. This is tramline bruising. They can get this from being beaten with a stick or a baton. So if you're seeing suspicious bruising, we need to be asking more questions and not just taking the word of the person that's with them. Next slide, graphic. Cigarette burns, what they look like. You can confuse this with picking. Okay, so be alert that this could be confused with picking. If you see that last slide and they come in, you may think that they've been picking themselves, and those could be cigarette burns. So just throwing it out there, just to be aware. Next slide. This is the petechiae in the throat. You can see from frequent forced oral sex. I think I pulled this off, and it's probably like a tonsillitis, but I wanted you to see the petechiae. Next slide. This is not a victim of human trafficking. He's a victim of a barotrauma, a mass squeeze. But I wanted you to see these strangulation injuries, especially in your children. They may come in and they're participating in the choking game, and they're not going to tell you, obviously, that this is what happened. They may come in complaining of a sore throat, but you may see petechiae around their eye or in their conjunctiva. So, you know, are we seeing some of these subconjunctival hemorrhages coming in and they're being explained away, and we're not looking for other clues? Next slide. This can be a delayed presentation for a human bite, especially in a child. You know, just to be aware to some of your signs that don't quite add up. Next slide. Possible, again, environmental signs of a trafficking victim. Again, the adult companion does all the speaking. You know those people that are up in your face. You know, that things just seem off. Maybe you are in triage and you're working, and you know how you do standard treatment protocols and you have a positive ultrasound for maybe an ectopic, and you don't have a bed open and you're trying to get one, and the person with them is like, we're taking them out of here, and you tell them, well, they could die because, you know, we think they have an ectopic pregnancy, and they still withdraw them from treatment. Traffickers will hospital shop. They will look for delayed times because they need to get that product back out and serviced and working for them. Next slide. Health outcomes of human trafficking. Next slide. Labor trafficking, again, they can get the chemical exposure, they can get amputations of their limbs and fingers and such. Sex trafficking, the leading cause of death is homicide and HIV/AIDS. And next slide. When we look at that, I put this slide here just because the CDC in 2017 found that the number of HIV diagnoses in youth age 13 to 24 was increased to 21%. So basically, of the 38,000 new HIV diagnoses in the U.S., 21% were among youth age 13 to 24. I might have said that wrong. I don't know if that was an increase, but I just want to show you that age. That's the ages of trafficking anywhere. So that contributes to maybe this risk-taking behavior, the hepatitises that we're seeing, some of these sexually transmitted infections can be from these forced sexual encounters possibly. Next slide. This is a school photo, and then those are the mug shots for the 18-month progression. So if you do not think that human trafficking is a healthcare problem, I think that they speak for themselves that it is. We need to be very careful that when these individuals are coming in, that we're not diagnostically overshadowing them and saying, wow, that's a prostitute, or that's this person, and we're not looking further. Because there are prostitutes by choice that are over the age of 18 that they're by choice living that lifestyle. That's not trafficking. But there are also prostitutes over 18 that are being trafficked, and then children are being trafficked. So we just need to look at this. And I work in a facility to where we are about to open our first safe house, and I work closely with other survivors of human trafficking. And when we get them early, we can really help them. So we need you guys to help identify so that we can get them the potential help that they need. Next slide. Barriers to identification. Next slide. Preconceived biases, frequent flyer and self-utilizer, bias. Is this person coming in all the time for back pain with no organic cause? Are they coming in for hyperventilation syndrome all the time? Are they coming in for, and the parent, the woman that's with them, the mother, tells you, oh, they hyperventilate all the time, that's why they're so afraid, they don't want you to touch them. And as they're running out the door, you see a bruise or a rope mark on their leg. Just, traffickers can be a mother, they're women too, so they'll tell you anything. And again, what are the profits from this crime? So it's happening. Also, lack of screening tools, lack of policies and procedures, and the fact that the victims do not self-disclose. That's why I want you to know the tattoos and know the red flags and put it together. Just like you have those patients, the quietest ones are the ones that'll die on you, because they don't tell you what's wrong. Same here. We all know those, So we need to just be alert for these clues. And I'm a sexual assault nurse examiner, and they are coming into your facilities. So know this, they are coming in for sexual assaults, and we may only be able as an adult to let them know what's happening to them is wrong and offer them resources like the hotline and let them know that it's a crime and there's resources available to them. We also need to know about diagnostic overshadowing, and that's where you have a diagnosis, next slide, that gets made of a major medical condition, and there's a tendency to attribute everything to that diagnosis, and you don't investigate or look further. So person comes in, self-mutilation or cut their wrist. The mother with them says, yep, they cut their wrist all the time, they're a cutter. You admit them. No one ever screens them for trafficking or asks the child what's going on and starts looking for clues. Next. Again, it just talks about the diagnostic overshadowing. Dr. Hannah Stucklosa, excellent resource with Heal Trafficking, and she put out a great article on diagnostic overshadowing. Next slide. Again, we talked about earlier our mandatory reporting guidelines, just knowing that under the age of 18 we are obligated to report. Next slide. Next slide. As healthcare providers, we may only be able to plant that seed that what is happening to them is a crime, not their fault, and offer a glimmer of hope that resources are available if they choose to accept them. And this is obviously for an adult. If it's a minor, we need to disclose. We need to report if we suspect. Okay, so let's go to the next slide, and let's look at the root causes of human trafficking. Okay, when we look at ACEs and ACEs science, next slide, and we ask what is that? Dr. Vincent Folletti in the 1990s conducted with the CDC and Kaiser Permanente a study of 17,000 participants in Southern California. It was a weight loss study that was looking at obesity, and they thought they were really cool because all these people were losing all this weight. And then when they were coming in for their follow-ups, they were like gaining it like in massive amounts. I mean, I've been there, I can put on some weight. And they were like, it violated kind of common sense. And these were 17,000 people, and they were all like coming and gaining weight. And these were middle-class Americans. So they started investigating it and looking further. Next slide. And they started looking at any negative experiences they had in their childhood, any negative health outcomes. And they started realizing that they had traumatic experiences under the age of 18, what we call adverse childhood experiences. And these can be abuse. When we talk about familiar or family ACEs, they can be physical, emotional, or sexual abuse, physical or emotional neglect, or household dysfunction, such as a relative that was incarcerated, committed suicide, or a parent that was struggling with addiction in the home, divorce. It could be bullying. There's an expanded ACEs from what Vincent Valletti put out. So, they can be someone that was bullied, the divorce, a parent that was deployed in the military, went away, or maybe died in the line of duty. Next slide. They can be adverse community experiences and climate experiences. And climate, obviously, Hurricane Dorian affected me. Community experiences, they can be your mass shootings. This traumatic stress in these children is affecting DNA. It's affecting mothers and their children in utero. It's affecting health outcomes. And we can no longer ignore the ACEs link. Next slide. This is an example of just an example of like an ACE questionnaire that's put out by the Center for Youth and Wellness Excellence. And the score goes to 10. So a point is given for each traumatic event, no matter how many times it occurs. And an ACEs score is basically like a cholesterol score for childhood trauma. So an ACEs score of 4 makes them twice as likely to cope by smoking, 7 times more likely to resort to alcohol for coping, and an ACEs score of 6 or more shortens the lifespan by 20 years. When we look at ACEs, next slide, they have an increased chance of COPD, 390%, suicide, 1,220%, and depression, 460%, and hepatitis, 240%. If they've had childhood trauma or these adverse experiences in childhood, 5 or more of them, their use of illicit drugs, 7 to 10 times more likely, and 3 times more likely to misuse prescription pain medications. When we look at our data on that suicide, according to the CDC, suicide was the second leading cause of death among individuals between the ages of 10 and 34, according to 2017 data. And there were more than twice as many suicides in the U.S. as there were homicides. 34.8 million children in the U.S. are affected by ACEs, 2 out of 3 adults, and 1 out of 8 adults have 4 or more ACEs. These are affecting our children. They're affecting their coping skills. They're affecting how they're acting out in schools. You're seeing this in learning disabilities. You're seeing behavioral problems and health problems. And that's contributing to the supply of vulnerable youth, which is fueling the human trafficking problem. Next slide. Next slide. This is a case study. This is a young child here, maybe 5 or 8. She doesn't have a lot of memories, a lot of photos. This is a photo of photo. There was other children in there, but they were cut out. But you can see she's haunted. She's got bags around her eyes. She looks quite sad. She has quite a story to tell. And she just wanted you to know as an adult that trauma survivors, they have trouble with recall. You may often think that they're being difficult, but it's physiologically impossible because of the hormonal dump in your system to respond in an appropriate manner to trauma. And she just wants you to know that she may be in an adult body and do adult acts, but they're just vulnerable children who had something really bad happen to them that changed the trajectory of their lives. And we need to start seeing them as those innocent children again, and not how they present as substance abusers and how we're labeling them. And let's look at her ACEs. She had a father that was deployed in the military, went away, and he was gone a couple of tours. He was like 19. He came back, wasn't the same, divorced her mother. Her mother had high ACEs scores of like 8 or 9. The mother then made poor choices with child care and did not have some factors that we can do to mitigate these ACEs factors. And the child was sexually assaulted at the time she was age 4 to 5 by one individual and then another individual and so on. And she thought that she would go to live with her father, who was going to be her savior, and he committed suicide with his duty weapon because he was a police officer, and she buried him on Father's Day when she was 15. And this is that child today. Next slide. She's speaking to you. Just know that damage done is not damage done, that there are ACEs science, there's ways to build resilience. Fortunately for me, I had teachers, I had other folks that really helped me along the way. And the only thing that saved me and helped me transform from an innocent child of God to a victim to a survivor and back to an innocent child of God is my faith. And by healing in a holistic approach, by the mind, the body, and the spirit, and being in a designated place of hope and healing to where you could confess those dark secrets and the unspeakable language of trauma. And I never thought I'd be grateful for what happened to me, but I am, because it allows me to decipher that language for others and hopefully open eyes to let you see that if we get these children and get them the help that they need, then maybe they won't have to go through what I did, which was almost 50 years of shame, guilt, fear, regret. You know, I threw myself into being a wounded healer. I thought that if I healed everybody else, then people would look at me and see what was wrong with me. And I did not practice self-care. I did not practice these things that I needed to, and I didn't know about resilience. I didn't know about meditation and yoga and coping skills. And it did come out. It started to come out, and I couldn't sleep. You know, I was on Ambien, and I'd wipe it, you know, wash it down with a little wine. But nothing. I'm on no meds, completely healed by the grace of God. And we just need to be making sure that we're taking care of these individuals holistically as well, whatever that is for them. Mine was faith. Others can be just getting mindful and learning coping strategies. But we need to really be looking at what trauma, and know that 60% of individuals under the age of 18 have had some type of, you know, sexual assault that if that happened to them, they don't ever report it. So we just need to be aware that these individuals are and they're making choices based on this fact. Next slide. Well, how does this relate to human trafficking? Next slide. The results of a 2017 ACEs study out of Florida indicated that children who suffered childhood trauma, especially those with a history of sexual abuse with high overall ACEs, have a high susceptibility to being trafficked for sex. Next slide. And we really need to focus prevention education in that group. 70-90% of commercially sexually exploited children have a history of sexual abuse. Children with sex abuse histories are 28 times more likely to be arrested for prostitution at some point in their lives. And remember, there are no child prostitutes. And adult prostitutes have a high risk of being trafficked. Next slide. According to RAIN, the Rape, Abuse, Incest National Network, which is an excellent resource of data, and they take data from a national crime victimization survey that surveys about 150,000 Americans each year, and they found that every 9 minutes, Child Protective Services substantiates or finds a claim of child sexual abuse. Child victims are often known to the perpetrator, 93% are known, and 80% are parents. Again, there's that familiar trafficking link. 80% are parents that are trafficking their children. Of all victims under 18, 2 out of 3 are ages 12 to 17, or 66%. That's our age to be trafficked, our prime age of trafficking. They are fleeing these homes, this abuse, they're going onto the streets, and within 2 days of going onto the streets or being homeless or running away, they're being picked up by a trafficker and exploited for sex. Next slide. That's 60,000 victims each year, children, substantiated or indicated sexual abuse. And that is just fueling the supply for human trafficking. Next slide. And we are seeing these translate into the healthcare system because they're coming in our behavioral control, behavioral complaints, our suicides, our violence in the healthcare industry. They're coming in for manifestations of trauma. And what are we doing? And I'm not saying it's wrong, and I'm not saying I didn't do it, but we're holding them down and we're injecting them, or we're doing things to them, and they've already been held down and raped. So they're going to act out. I was very claustrophobic. There were certain things that would send me in complete panic mode, and when I'm in an emotional flashback, I cannot control what's happening. You can't. I couldn't. That doesn't mean I went out and killed someone. No, that doesn't excuse that. I did not. I never hurt anybody like that, but I'm telling you, I said things that were horrid, and they haunt me today. Next slide. Next slide. Okay, let's stay here. When we look at sexual abuse, children link concepts of abuse with love and sex. They're sexualized early, and they see themselves as sex objects. And they kind of see the world as unsafe. And they have these psychological and physical boundaries that have been flawed, because what do you do when your father is supposed to love you or your, that stepfather, that caretaker, and every daddy, every girl wants their daddy to love them, and they sexually assault you. So lines get blurred, things get all icky and messed up. So what they do is they get used to having no control over their body, and it puts them at a high risk to be trafficked because it's a familiar situation to them. So they disassociate from the negative symptoms that go along with that act. So they look forward to the reward. So say they sit on their uncle's lap or their brother's lap, and he, gives them this Nintendo game. He loves them, shows them attention. Nothing happens. Next time, he does something icky. And that icky brings shame, guilt, fear, regret, self-loathing that plagues them, and that inner critic, that's never quiet. I was held a hostage by my mind. I cannot tell you what it feels like to not to have that. I mean, I'm free, and I just want to shout it from the rooftops. And so they're conditioned. Sexual abuse is a conditioning for prostitution and for childhood, for sex trafficking, because they get used to this reward, this money, or this good, and they see themselves as, well, that's how I get attention. That's what the love is. They get it confused, and they're like, it's a known. A known is this guy has, what they're doing is they're, seeing these children that are on the streets, they're offering them a warm meal, a place to stay, or a loving relationship, and then they're breaking them down, brainwashing them, and getting them to realize that they see their trafficking situation as just normal. Well, it's just their boyfriend who wants them to have sex, for money, because they need the money to pay the rent. Well, then he wants them to do that to 2 or 3 more times. But that's better than being on the street, because you didn't know what was going to happen to you on the street. So what choice do they have? I mean, who wants to make those choices? So we just need to be aware of the conditioning, that childhood sexual abuse, and how it is fueling this problem. Darkness to Light has an excellent program for child sexual abuse, and also there's a great videos on there. All this is free. You can download it and stuff, and it's on how sex trafficking and sexual abuse is tied. Jason's Foundation has excellent resources on childhood suicide and how to prevent that. Next slide. That's just the...
it's spinning.
That's okay. Probably, let's see if I can do this. Maybe not. Okay, anyway. Basically, every 92 seconds, an American is sexually assaulted. 1 out of 6 American women has been a victim of attempted or completed rape in a lifetime. 1 out of 33 men have experienced attempted or completed rape in a lifetime. And if you have a history of sexual assault, you are very likely to be trafficked, to fall prey to a trafficker. So that's why we need to really look at that. 1 out of every 3 Native women, while being raped in a lifetime, 1 out of every 3 Native American women will be raped in a lifetime. That's 2.5 times the normal of everybody else, and they're only 1% of the population. And they have a high incidence of being trafficked for sex, are indigenous women. So we really need to get into the reservations and on these tribal lands and start educating. When we look at opioid use as a means of coercion for traffickers and substance use, Dr. Daniel Sumrock, and I'm almost done and I'll close. Dr. Daniel Sumrock, he is the Director of Addiction Services at the University of Tennessee Health Science Center. He said that addiction should be defined as ritualized compulsive comfort seeking, a normal response to adverse childhood experiences, much like bleeding is a normal response to being stabbed. A coping mechanism they adopted due to an environment where no healthy alternative was available. He had over 1,200 patients in his pain clinic, his chronic pain clinic, and the majority of them had 3 or more ACEs. And he found that if they had one addiction, they had co-occurring addictions. So we need to be educating and really trying to get a handle on our sex addiction individuals and trying to look at the root causes, because pornography is a gateway into human trafficking. And then the more ACEs a teen is exposed to, the more likely it is that they will begin drug use at an early age. One study found that a higher number of ACEs was associated with an increased likelihood of substance use before the age of 14. And people who experience childhood trauma use more pain medicines and more prescription drugs. And it can have significant impact on substance abuse and alcohol disorders in adolescents. So we're seeing this generational trauma. It's not sustainable. This is going to intersect in our healthcare, and the economic impact from ACEs, which I can't show you on the slide, it's over $462 billion a year from child maltreatment reports, and also mental illness, 462 or 450 billion each year that we're spending on mental health. When you add those into obesity, and how we're telling people lose weight, eat healthy, go run, stop smoking. But that's a coping mechanism to an underlying trauma. You're going to take away their coping mechanism. We have to get to the root cause of the problem. And when we do that, we fundamentally will save money. Dr. Vincent Folletti put out a study in 2019, a new one, the same guy that did CDC data, and show that you can save billions of dollars by investing in childhood trauma. And it will help us decrease the human trafficking supply. Vermont's United States Attorney Christina E. Nolan emphasized in an article the link between human trafficking and the opioid crisis in Vermont, stating human trafficking continues to be one of the most dangerous but least understood aspects of the opioid trade in Vermont. Drug dealers coerce addicts to perform commercial sex acts for the benefit of the dealers' illegal organizations, deliberately perpetuating the victim's addiction in order to exploit them for commercial gain. They are preying on their vulnerabilities. They are going into your AA groups, your Narcotics Anonymous groups, and homeless shelters. They are even getting admitted saying they want to go through detox, and they don't. They want to recruit. They're looking for vulnerable individuals. So there's multiple intersect points that we need to be educating because they're crafty, and they're going in and exploiting these vulnerable victims. They're preying on their addictions. They're paying commissary notes in prisons so that they get into a debt bondage situation. They're going online, they're looking at mugshot photos, seeing these women arrested for prostitution, they're friending them, and they are building a relationship, and as soon as they get out of prison, they come stay with them, they give them some drugs. Same thing they're doing with kids. You know, they're maybe waiting outside for them to need alcohol. So they're playing off of these vulnerabilities, these addictions, and that's okay. I think we're out of time anyway, so I'm good. So we just need to be conscious of this and what they're doing and how crafty they are. I'm not going to get to it. My longer presentation goes into, again, we need to look at the child welfare system because these child maltreatment reports for the substance abuse, the opioid crisis is fueling the human trafficking supply and demand. And if you have ACEs scores of high ACEs scores, especially where abuse and neglect are concerned, you're 59% more likelihood to be arrested as a juvenile. You're 28 times more likely, you have a 28% increased chance of committing a violent crime, and 30% chance also of victimizing another adult. So this is going into our school shootings, our violence overall. So we really, if we want to combat human trafficking, we have to look at ACEs science. We need to look at a detailed assessment and move forward that way. And know that the homeless are quite vulnerable to being trafficked. And there are over 4,000 unaccompanied children under the age of 18. And 51% of homeless children they sleep outside in a car or they live someplace uninhabitable. So if you're sleeping in a car and you're living in someplace uninhabitable, what are you going to do? Someone comes up to you and offers you a place to sleep. So in closing, how they're grooming them on social media is you're checking in. Your daughter maybe said, I had a fight with my mom and she doesn't understand me. She checks in, she's going to this event. They go to that event. They know what she looks like because she's put it all on social media. It's a good looking guy. He goes up to her. What girl doesn't want a good looking guy to pay attention to them or vice versa? And he starts this conversation and they groom them. They groom them over 2-3 months. They entice them to meet them, and then they take them or they sextort them or they drug them. And there's many ways that they're trafficking them. And they're being trafficked while going to school. So just know that it's out there. And I've got information in your packets on how to combat it. I'm not gonna get into neurodevelopment, but I had a picture of a brain. Oh,
Is there any slide that you want me to go to?
just one more. Next slide, next slide. Next slide, next slide. Just keep going, keep going. I just want to show you the picture of the brain. Next slide, next slide.